Perform hand hygiene. Gather and clean required examination equipment. You will need a tape measure, a Pinard stethoscope, or Doppler ultrasound scanner. The patient should be positioned on an examination couch with their head slightly raised on a pillow. Women should always be positioned in semi-recumbent position and not supine after 20 weeks of gestation. If the woman is required to be supine, which is rare, they will need tilted greater than 15 degrees or the uterus manually displaced. Check to see if the patient wishes to empty their bladder prior to the examination. Assess the patient for any distress and ensure they are well enough for you to proceed. Ask if they have any pain or other symptoms, clarifying as necessary. Make sure the abdomen is adequately exposed from symphysis pubis to xiphus sternum, whilst also taking care to maintain privacy and dignity. Inspect the abdomen for its size, shape, skin changes, scars, rashes, and bruising. You may also see fetal movement. First, determine which pole, if any, is in the upper part of the uterus. Next, assess the symphysis fundal height. Use the ulnar border of your left hand to identify the fundus, then locate the upper border of the pubic symphysis. Place a tape measure face down between these 2 points, and then flip over to record the distance in centimeters. Next, palpate laterally. Place hands on either side of the uterus and apply gentle pressure. In a longitudinal lie, the back should be palpable down one side, and you may feel limbs on the other. However, the lie may also be transverse or oblique. Next, palpate the lower segment of the uterus. Place your hands either side of the lower pole of the uterus just above the symphysis pubis and apply firm pressure medially, feeling for the presentation. In late pregnancy, the level of engagement should also be assessed. Assessment of the lower pole can be carried out using Pollock's grip. This maneuver is used to assess engagement and involves grasping the lower portion of the abdomen just above the symphysis pubis with the thumb and fingers on either side to determine the fifths of the fetal head palpable. Based on your assessment of fetal position, place the Pinard stethoscope or ultrasound scanner between the fetal shoulders on the fetal back. Palpate the maternal radial pulse at the same time to determine if you are hearing the fetal or maternal pulse. Ensure the patient is covered up again and thank the patient. Remove gloves and dispose of them in the clinical waste. Perform hand hygiene. Explain your findings to the patient and complete appropriate documentation in the clinical record.